We'll start investigating the reproductive system by picking up where we left off at the end, pun intended, of the GI tract. Here we have the rectum and anus in the pelvic area. We have the sacrum here to mark the most posterior side. And as we move forward, we can see that the organs in the pelvis are covered by this lining of tissue that covers the entire abdominal pelvic cavity. That is the peritoneal lining. So you can see here that it's going to fold over the top of the uterus here in a female pelvis. We have the fundus, or the part that sticks up here. We have the urinary bladder, depending on its state of how full it is, can extend fairly high up here or be compressed down in here. So urinary bladder right there. And then very anteriorly we have the pubic symphysis of the pubic bones coming together on that side. Now, one thing about the peritoneal lining is that it creates several pouches as it rolls over these organs. So here we have the vesico-uterine pouch between the uterus and the bladder, and the recto-uterine pouch here, also known as the pouch of Douglas. And that is the deepest space in the pelvic cavity when someone is standing up or seated. Off to the side we can see the oviduct leading from the uterus to the ovary, and the ovary is illustrated here on the more lateral side of the body wall. Now real quick, if we take a look here and put this back in place, we can actually see how the oviduct leaves the uterus there and heads outward. And we'll pull this back again. And that's going to lead to the ovary. And the ovary has ovarian vessels, an ovarian artery and vein. Returning to the uterus, we can see the fundus here, and then we have the rest of the uterus here, the body, underneath the peritoneal lining, and here it meets up with a thickened area at its base. This is called the cervix, and the lumen here, or the internal side of the uterus, is where implantation can occur in pregnancy, and shedding of material, or endometrium, occurs during the menstrual cycle. Where the uterus meets the cervix, this thickened area, we have an internal os, and then at its exit we have what's called the external os, where it meets the vagina. The vagina wraps around the opening of the cervix here and forms these little horns that are called fornices, and the vagina continues down inferiorly and empties into the vestibule. Now the vestibule is a common site for both the reproductive system and the urinary system. And right here we have the urethra from the urinary bladder emptying anterior to the vaginal opening. We'll now take a look at a similar set of structures in a male pelvic model. So you can see it's a little bit different here. We'll take this part off for the moment and return to it in just a bit, so it looks a little bit more like the model we just saw. But once again, we can see the sacrum here very posteriorly. We have the sigmoid colon becoming the rectum and emptying at the anus there. And continuing forward, there is no uterus. So the next organ we encounter is the urinary bladder just here. Once again, the peritoneal lining covers all these tissues and creates a fold, but in this case, since there's no uterus, we only have what's called the rectovesical pouch. This model, we can see a bit of the pubic bone coming forward to the pubic symphysis, where the right and left pubic bones are going to meet. Now, at the base of the urinary bladder, we have this organ in males, and this is the prostate gland. It's going to secrete fluids and to the ejaculate, and it is also present here at the base of the bladder. So enlargement of this gland can cause some significant issues with urination. Returning to the outside, we can see that unlike the ovaries, which are located internally, the testes, despite coming from the same place, coming from inside the body, pull their testicular artery and vein down the side and actually exit the body through what's known as the superficial inguinal ring. So we have the testicular artery and vein traveling inferiorly here to meet up with the testes themselves. And as they are there, blood is coming to the testes and leaving. You'll notice that the veins form a mesh, kind of a mesh-like network around the artery. That's called the pampiniform plexus, and it actually helps to cool the blood going to the testes, since sperm production happens slightly lower than normal body temperature if it's going to be efficient. Now, speaking of sperm production, the spermatozoa created in the testes will enter this little cap sitting on the testes here called the epididymis, which has a head and a body and a tail and eventually turns around and becomes a duct that travels back to the prostate. This is called the ductus deferens, although you'll probably hear it called the vas deferens on a pretty regular basis. And if we take this off once again, we can see that the ductus deferens is going to travel inferior to the bladder here, entering just inferior to it into the posterior side of the prostate gland. But it doesn't stay alone. Instead, as the ductus deferens travels closer to the prostate, it meets up with this gland, the seminal vesicle. And the seminal vesicle and ductus deferens have a shared ejaculatory duct that then empties into the prostate. So once again, ejaculatory duct for the seminal vesicle and ductus deferens meets up with the prostatic urethra, draining the bladder. Now from there, the urethra is going to continue onto the inferior portion of the perineum, and it's going to be surrounded by part of the penis. And at that point, it is going to be called the penile or spongy urethra. So it passes through muscle as a membranous urethra, continues onto the penis as the spongy or penile urethra, and the tissue in which it's encased is called the corpus spongiosum. The rest of the penis is made of two crura, making up the shaft of the penis here, along with the corpus spongiosum. So we have the corpus cavernosum on the right and left, joining with the corpus spongiosum, and they are going to form the shaft of the penis as a whole. The end of the penis here has an expanded area of the corpus spongiosum called the glans, not gland, but glan, no D at the end, and or head of the penis just there, and we have the opening of the urethra there called the external urethral meatus, and that is where urine is going to exit normally in the male. Because that pathway can be slightly difficult to follow, we're going to do the same procedure with a slightly different model. So here, we'll take the right side from the left side, and right now, we should be able to follow the path of the urethra. From the bladder, we have the urethra leaving, passing through the prostate is the prostatic urethra, ejaculatory duct for the seminal vesicle and ductus deferens exits into the prostatic urethra there, passes through muscle, and thankfully that muscle keeps us continent, allows for urinary continence. That's the membranous urethra. Then we have the long spongy urethra traveling through the corpus spongiosum all the way out to the external meatus at the tip of the penis right there. Now, the tissues that make up the penis can be a little bit challenging to see, so here we will reassemble the model and then remove the penis so that we can actually see that we've got this bug-like looking cross-section with corpus cavernosum on the right and left, and a midline but ventral corpus spongiosum with the spongy urethra just in the center of it.